Okay, so for our medical moment today, we're going to talk about the dog with the swollen leg. You may recall about a week and a half ago, a golden retriever came in because she was limping, and we found that her leg was swollen, and it was swollen from about halfway from the thigh all the way down to the ankle. It did not have an orthopedic problem. It didn't creak or grind at the knee. It did not have a drawer sign like a cruciate, but it did have a big puffy swollen leg. And at the time, it did not have a fever, though it had received an anti-inflammatory from the pet sitters before it got here. The next day, the swelling was bigger and the dog spiked a pretty high fever. So we took some x-rays and found that the bones were healthy, but there was soft tissue swelling. We couldn't find an explanation for the puffy leg. We shaved her from her toes to her hip to look for any puncture wounds, cuts, scrapes, abrasions. There were not any. Her blood work was pretty normal. We put her on aggressive fluids and antibiotics, and the fever started to come down, but the leg continued to swell. So at that point, we shuffled her off to the internal medicine specialist. No, actually, Dr. Kopit came in and did an ultrasound. I wasn't here that day, but what did Dr. Kopit find?
Pocket of fluid.
So there was a pocket of fluid. Was it above the knee?
It was in the thigh.
In the thigh, yeah. And so he was able to aspirate that fluid and got bacteria. So it was an infection with no apparent cause. So she went off to the specialist, and they gave her a very guarded prognosis. The concern was that this was one of those scary bacterial infections that could take off and go through the tissue planes all over the body, up and into the groin. And my understanding is she ended up with some edema and bruising, or went all the way up to her armpits. So she's a pretty sick dog. They kept her on aggressive fluids and antibiotics 24 hours a day around the clock. And after several days of that, she started to improve, and her swelling went down, though not back to normal. When she was discharged from the critical care hospital, she was sent home with oral antibiotics, which she's still on now, with the understanding that once she was finally healed, that she may need physical therapy because the big scar may well form and make this leg stiff. And she may end up needing physical therapy to break it down and give her a range of motion.
Was it her back leg? Or?
Yeah, it was a back leg.
Could back do anything with the hips at any point? Was any kind of problem with the...
The infection, it started off in the muscles of the thigh. And these infections can go weird places. But the big issue is that sometimes when dogs have such big infection, it overwhelms their ability to clot and unclot their blood. So that you can end up with what's called DIC. We talked about that before. And it can become a real critical ICU moment. But she actually did well.
Why did it start? Why did it happen?
Great question. Why did it happen? We still don't know. Still don't know. If a draining tract forms that doesn't heal, if the whole thing goes down and then there's one area that doesn't heal, I'm sure that's the place to look to see, is there some foreign body, some grass on, some sticker that started at her foot that worked its way up to the thigh and stopped. It's possible. If that happened, the skin at the entry point is healed, because there is no entry point that we can see. But what I would anticipate would be to watch for any drainage points. And if they remain drainage points, there may be a time when surgery makes sense to pursue the tract and to look for something.
Because it comes from an outside reason, right? Not
Yeah,
inside.
typically comes from the outside. Right? Yeah. But it's a mystery. We don't know how it got there. Any other comments on that?
Happens in people too.
Right, it's kind of in the news right now because there's a few people that have had
Their
really
limbs
scary.
amputated and things with no known cause of it.
Okay, that's it. Medical moment.